Did you know that on average over 50 Malaysians die of heart disease every single day? This makes it one of the leading causes of death in Malaysia. Heart attacks can happen anywhere, anytime. And when they do, immediate healthcare is critical. Take this guy for instance.
Sir, are you okay?
Having a chest pain.
Hang on, I'll help you.
Kamu panggil siapa?
Emergency services.
Cuba kamu panggil ni.
Hello?
Glen Eagles has their own dedicated emergency line that you can call 24 hours a day. Wow, that was quick. Mestilah, because when a person has a heart attack, appropriate action must be taken within the first 60 minutes. This is often referred to as the golden hour. So, doctor, tell us, why is the golden hour so important?
Well, a heart attack is a medical emergency. The longer it goes on for, the more damage is happening to his heart. And the sooner that we can restore the blood flow, the higher the chances of survival.
So it's a really good thing we got him in quick.
Yeah, he's lucky that he came in early. And if there's no complications, then he should do quite well. So let's go.
Well, doctor, we're now in the cardiovascular lab. So what happens now?
Well, we've brought the patient up to the cardiovascular lab. The heart attack is caused by a blockage in the artery on the front of his heart. The cardiologist has managed to put a wire through the blocked artery. He's put a balloon down. He's managed to remove the blockage. There's still a very severe narrowing, and he's now fixed that by putting in a stent. And now that the flow to the blocked artery has returned back to normal, the heart attack has been treated, and we are now going to put the patient into intensive care unit.
Oh, great.
How are you? Better? Any more chest pain?
No more chest pain.
It's good that you come on time, but you had a massive heart attack. Everything went well, so we just need to monitor you for a couple more days before you can go.
Thank you, Doctor.
With 2 full-time experienced interventional cardiologists backed by a competent clinical team, the 24-hour heart attack facility at Glen Eagles Hospital, Kota Kinabalu, is best equipped to help you and your family members in the time of a heart attack. For any inquiries, call now on 088 51 8888. That's 088 51 8888.
Good morning, everyone. Thank you for joining our YouTube live today, exclusively for Qhazanah Sabah Sdn Bhd in collaboration with CMA Consultancy. My name is Vivian, and today we have Dr. Ratha, Krishnan, Sriram. He's our sessional colorectal surgeon to talk about colorectal cancer. Before we start, allow me to share with you a bit of Dr. Krishnan's background. Dr. Krishnan completed his undergraduate medical training at International Medical University in 2005. He then completed master's in surgery from UKM in 2013 before pursuing with subspecialty training in colorectal surgery. Locally, Dr. Krishnan completed his training at Hospital University Kebangsaan Malaysia and Hospital Tuanku Jaafar, Seremban. He then went on his overseas training in Taiwan and South Korea, focusing on laparoscopic and robotic colorectal cancer surgery. Dr. Krishnan is currently the head of colorectal surgery unit at Queen Elizabeth Hospital, Kota Kinabalu, and the only colorectal surgeon in Sabah for the time being. He performs most of his cancer surgeries laparoscopically and believes that minimal invasive surgery could help his patients recover much faster and continue with subsequent cancer treatments earlier. He is a strong believer of enhanced recovery after surgery and has a special interest in clinical nutrition. Dr. Krishnan looks forward to provide the best cutting-edge treatment for colorectal disorders in general and holistic and ideal approach for colorectal cancer treatment for people in Sabah. If you have a question for Dr. Krishnan, please send us your question in the comment box and Dr. Krishnan will try to answer your question towards the end of our session. So without further ado, I will pass this session to Doctor. Good day, Doctor.
Hi, thanks Vivian. Thank you very much for the kind introduction. Hi everyone, I'm Krishnan, a colorectal surgeon from Queen Elizabeth, as Vivian has mentioned earlier. Today I'll probably be talking about colorectal cancers. I'm going to just basically go through in brief what is colorectal cancers, what's our statistics in this country, and what are simple things we actually can go to prevent and things like that as well. If you look at the contents that we're going to talk about today, I'm going to talk a bit of introduction, then we go on to Malaysian statistics on colorectal cancers. What are the risk factors for colorectal cancers, how we can actually prevent that, what are the signs and symptoms for colorectal cancers, how do we watch out, who are the patients that need to be a bit more careful, what are the types of screening that we have for colorectal cancers, the management, and simple, just going to talk very simple in the management part, and a bit of summary and take home message as well after that. When you talk about colorectal cancers, kita panggil cancer usus lah. Basically it actually starts in the colon, kita panggil usus besar, and also rectum, which is we call it a dubur, rectum. So in combination both of this is actually known as the colorectal cancers. It can occur any part of the colon or rectum, tak semestinya at only one part, usus akhir ke, tengah-tengah ke, it can happen anywhere along the usus. So it's either usus besar ataupun the rectum, dubur we say. This is actually a picture of colon, kita punya usus. If you look at here, the yellow color, pink color, all these things actually the usus besar, and it comes down all the way. And if you see down there is what we call the rectum, it's kita panggil rectum ataupun dubur. This is where basically najis kita, sebelum kita buang najis, dia tertakung kat situ. So it's a bit different in terms of that. And why does cancer happens? Most of the time cancer happens, we don't know what is the exact cause why cancer happens. But when it happens, it knows most of the time it happens through what we call, kita panggil polyp. Kita tengok gambar kat sini is a normal mucosa. Over time dia akan jadi, kita panggil adenoma. Dia akan bengkak sikit, then dia akan jadi sejenis polip, ketemuan kecil, then becomes bigger and eventually dia akan jadi cancer. This is the apa orang kata pathway yang biasa people talk about when it comes to cancer pathway. So, and do you guys know that in Malaysia colorectal cancer is the second most common cancer? The cancer kedua paling tertinggi. If you look at for males, for lelaki, the cancer the number one, is the most common cancer. But when you talk about females, is the second most common cancer after the breast cancer. Okay, and roughly the incidence is every 100,000 people, setiap 100,000 orang, lebih kurang 21 orang will have about cancer. So it's actually quite a high number if you look at it, and it's increasing. And this data that we have is based on about 4 or 5 years ago data, and we don't have the latest data what we have. And it's been shown that incidence is much more higher in Chinese population, followed by Malays and Indians after that as well. Okay, this is just a graph looking at the males and females, comparing all the different types of cancers. This shows colorectal cancer, which is on top of the list for males. And for females, you look at it, colorectal cancer comes a second after the breast cancer. So it's something that it's something we have to really pay attention and really look out for early signs and symptoms and prevent that if possible. We have to can do that. Yeah, and if you look at the same thing as well for males and females, yeah, among patients, younger patients between 25 to 60 years old, is also the same. Yeah, colorectal cancers, first for male, second for females. And even for patients with age of 60 and above, also shows the same thing. Colorectal cancer is number one for males and second for females. So it doesn't really follow the age. People cakap, okay, saya masih muda lagi, the cancer will not come to me. Yeah, so it's something that everybody has to be careful, especially in Sabah or my practice, my experience in Sabah. These colorectal cancers tend to happen much more in younger patients, whom we think that jarang these patients won't have cancer, but surprisingly this is not the way what we think it's supposed to be as well. And I said earlier, exact cause of cancer is not known. We don't know what the cancer happens. It could be multifactorial. Yeah? When we say multifactorial, it means basically whether we're talking about the diet, the food that we eat, makanan yang kita makan, the obesity, yeah, whether we do exercise or don't do exercise, type of lifestyle we do, the environment. Of course, it also could be partly genetic to a certain extent. Yeah, and there are always risk factors that are modifiable risk factors and not modifiable risk factors. When I say modifiable risk factors, is something that we can prevent. Yeah, we just change the way we live, the things that we do to a certain extent. We can actually prevent or get away from this kind of risk factors such as smoking, yeah, obesity, the low fibers in your food, sedentary lifestyle. Basically, you're talking about tabo exercise, stay at home, watching TV all the time. This is something that we know in generally is not healthy lifestyle as well. And when there's something that is non-modifiable, I mean, no matter what we do, we cannot change this. In terms of our age, I don't think we can go back 5 years younger and all things like that. So it's something that we cannot change. Personal history, whether you've already had cancer before this, or you already had history of polyp before this, is already there in you, and it's something that we cannot change it as well. Or family history, if any of family histories has got a cancer, so basically you are already at a small risk that you might be getting it. Okay, especially if your family history, member of your family, they develop cancer at much more younger age. There's something that we have to look into that as well. And early stages of colorectal cancers basically may have no signs and symptoms. So cancer yang awal usually won't have any. The patient can be perfectly normal, dia akan makan macam biasa, buang air besar macam biasa. You won't have any symptoms. Most of the time, the signs and symptom comes when the disease is more progressed, lebih mudarat. So sometimes a small signs and symptoms that we get, we tend to take it very lightly, and we say this is just one-off thing and I don't need to check on that. But unfortunately, this could be the only sign or symptom that you might get before the disease presents later in a much more advanced state. Yeah, and okay, the signs and symptoms and what the patient can present, kan apa yang boleh dapat, it could be a lot of things. Yeah, we're talking about rectal bleeding, pendarahan masa buang air besar. Bila kita buang air besar tu is a mucoid stools lah, it's like a discharge macam lendir. Unintentional weight loss, berat badan yang menurun tanpa kita mau, without dieting, without exercise, loss of appetite, there's no selera makan, there's always uncomfortable abdomen, tak selesa, kembung, could be sometimes macam tak selesa je abdomen. So altered bowel habits is like when you pass motion, if you used to pass motion every day, now you're passing motion probably every 2-3 days once, or you used to pass motion daily, now you're passing motion 3-4 days, 4 times a day. The consistency of the najis pun berbeza, more cerit-berit, is something that we need to pay a bit more extra attention. Tenesmus is something like a feeling that you get bila kita sudah buang air besar, you feel like masih tak complete, masih lagi something is going on like that. Constipation is basically sembelit. perianal symptoms basically you're talking about pendarahan ke, gatal, itchiness around tempat buang air besar, ya. Anemia is kurang darah, is also usually a bit more later stage of the disease. Or abdominal mass, bila kita ada ketumbuhan yang lebih besar, you feel rasa perut tu ada something is there like that, ya. Or rectal mass as well. So we have so many symptoms that we talked about earlier, but there are few signs and symptoms that if this happens, you have to pay extra attention. You don't have to wait for it, you have to see a doctor as early as possible, especially if you have rectal bleeding, pendarahan semasa buang air besar. Bila altered bowel habits, iaitu bila kita buang air besar kita is used to be daily, now is not based on the old schedule, or the consistency of the najis pun berbeza compared to before. When you have significant weight loss, you have unexplained anemia, when your darah kurang and you cannot explain why your darah is kurang, or when you have a palpable abdominal mass, bila ada ketumbuhan boleh dirasa. Okay, so that's why it's very important for us to screen for colorectal cancers, because the symptoms and signs can be very vague, and most of the time by the time you get the signs and symptoms it's already too late. So we don't want this. If you look at the data, I'll show you all later, most of the cancers are they do come to us with a very much later stage. So it's very important for us to do screening. Screening is to check and pick up early. Basically when you do screening, the whole two ideas is actually to detect cancer at early stage. We want to tangkap cancer when it's still the second is not just to detect cancer but to detect polyp, precancerous lesion. Macam saya katakan tadi, any cancer that happens usually starts off with the polyp and then it progresses to become cancer. So when we do screening, is we want to catch the lesions over here or here, then take it out, kita buang, before the thing progresses to become cancer. So it's very important why we do screening. If you look at this chart, our National Registry of Cancers, you see, if you look at stage 3 and stage 4 disease, right, almost 65 to 70% of patients, they do come to us at a much more later stage, which is stage 3 and stage 4. And it's only about 30%, both the sides, male or female, they come to us at stage 1 and stage 2. We know the later the stage, the prognosis is not very good. So the earlier the stage, the prognosis is much more better. We are actually aiming for complete curative. Kita betul-betul nak sembuhkan. And if you look at this, so who should be screened? Who should be screened? Based on our national Malaysian guidelines, anybody more than 50 and above. Or if those who are aged below 50, if they have a personal history or family history, so then they need to be screened. Okay, so why we do is 50? Because the most cancer happens after age. But if you already have someone in the family they've got cancer also at the age of 45, then you as another member in the family should be screened at least about 10 years earlier. 10 years or so, if 45, by 35 you should start your screening done earlier. And screening, as I said, is meant for asymptomatic patients. That means you don't have any symptom, langsung you're perfectly well, tidak ada masalah apa-apa, then you go for screening to check for early signs. When you already have signs and symptoms yang saya katakan earlier, macam pendarahan usus ke, pendarahan masa buang air besar, all this, that means you already ada tanda-tanda or gejala-gejala. So you don't wait nak kata I nak pergi buat screening. No, then you need to be investigated. Maksud saya, we need to check you, kenapa you ada pendarahan begitu. We need to check you to say kenapa your berat badan is coming down, why your darah turun. So you need to be checked. It's normal screening. Very understand the screening is mainly for asymptomatic patient yang tak ada apa-apa gejala. Okay, what are the methods of screening that we have in our country? Fecal occult blood, basically we check darah dalam najis. Colonoscopy is something like a scope teropong kita masukkan tempat buang air besar and kita tengok usus. CT colonography is jenis CT scan yang kita buat ataupun stool DNA is hardly done because it's very expensive. Okay. So go one by one. Fecal occult blood, which is kita panggil check najis dalam darah, is basically the most simple and very cheap to, and it can be done easily in any clinic or setting and all as well. So when we do screening, the whole aim or target kita untuk buat screening is kita nak screen seramai yang boleh dengan kos yang paling rendah. So we cannot afford to do something this expensive and then a target kita nak check semua orang in the country. So it's going to be not feasible. So one of the ways is fecal occult blood, which is cheap. It can be done yearly. The minute the test shows positive, baru kita go on for the next step of investigation, which is colonoscopy. So we filter as much as possible first. Okay. So the next step is actually colonoscopy. Of course, colonoscopy is the best because you are directly looking at the colon wall. And if at all, if you see something, we can actually take out the polyp at the same setting or same time when we do the colonoscopy. It usually takes about 30 minutes. Daycare procedure, patient comes on the same day, within a few hours they go back home, because the procedure only takes about 30 minutes, but you need to be observed a bit more longer and all of that. So this is a picture basically shows how the colonoscopy is done. It goes through where we pass motion, tempat berak, it goes all the way into the colon, comes down, and along the side, if we see something suspicious, we can take it out. If there's a growth, then we have to do a proper biopsy. This is an example how the colonoscopy looks masa kita buat teropong. Kita nampak polyp kat sana, so we can always take out the polyp at the same setting. And usually if the colonoscopy is done and you see something a bit more tumor, bigger, looks like already a cancer, then we might not be able to completely remove this. So we end up just probably take out the biopsy, kita ambil isi sikit, pastikan apakah benda tu. So this is also a role of colonoscopy. So in summary, secara ringkasan, when we talk about screening, first of all kita kena tanya diri kita, are we symptomatic or not symptomatic? Okay, if you already have symptoms, then jangan pergi buat screening, and you need to be investigated. Kita kena perlu check betul-betul. Okay, so if you are asymptomatic, if you belong in the risk of high risk group, which I said earlier, in terms of umur more than 50 years old, or you have family history. If more than 50 years old, you have no family history, you need to get screening done. Start off with the fecal occult blood and subsequently colonoscopy. But if you already have family history or personal history, then the colonoscopy or this thing has to be done at least 10 years earlier than the family member. Okay, so colonoscopy could start as early as 10 or 20 in patients with inherited. There are some conditions where it runs in the family. For this kind of something like kita panggil FAP, so this for this group of patients, the screening starts as early as mungkin umur 10-15 tahun lagi. So this is a very special condition which I'm not going to talk about it today. So we've done about screening, we've done about detecting. So the next thing is, what are the management? How do we treat these cancers that once we detect them? Okay, so as I said earlier, the cancer treatment depends on the stage of the disease. The earlier the stage you detected it, you treat it, the better the results of the treatment. Okay, and what is staging? Macam kita kata, I keep on saying your stage. What is stage? It's a process to certain the extent of the disease. Maksudnya kita is a process untuk kita pastikan kesakitan itu, what are the level of the dia merebak ke tidak, or is it tempat itu saja ke? So it's a process. It's a local disease or metastatic. Local disease maksudnya cancer tu di situ saja. When you say metastatic disease, means the cancer has merebak pergi tempat yang lain. So one of the most commonly used staging is kita panggil TNM staging. I don't think you need to remember this, is very complicated, not for your level, but basically you need to know that earlier the cancer and the stage increases as the cancer grows bigger and bigger. It also depends on the whether cancer itu pergi kepada limpa atau dia pergi tempat organ-organ yang lain, other organs. And how we do we stage? There are two ways of staging. Of course, the first one is imaging. Another one is surgery, bila kita buat operation daripada kita punya specimen tu. Okay, so most of the time before doctor buat operation, staging is very important. For us to know whether this is a curative disease or is a palliative disease. Okay, one of the commonest or the must do staging is CT staging. For any colon cancers, kita nak tengok cancer tu di situ. Also we want to look at the liver or other places whether cancer is spread. But for rectal cancer, macam cancer dekat dubur, on top of the CT scan, MRI is also another thing that is a must to do for us to decide. And PET scan is only done, it's not routinely done, it's only done when it's either the CT scan or PET scan shows something that is equivocal. We're not sure whether this is cancer or not cancer. So for the benefit of that, for the treatment, so PET scan will be useful for that. This is an example of a CT scan. This is a MRI which focuses hanya kepada usus, rectum sahaja. And this is the PET scan, basically look at the whole body. Whole body, see whether the cancer is anywhere else on the body as well. So when we talk about treatment, we can divide it into proper just endoscopic treatment. Endoscopic treatment is masa kita buat teropong itself, kita settle the issue. Is especially for early T1 ataupun cancer yang paling awal, ataupun for patients yang umur dia terlampau tinggi ataupun they have a lot of problems where they cannot go through a proper surgery, or abuse, risiko untuk abuse is tinggi. So for these patients we do an endoscopic treatment itself. And we must understand, even walaupun cancer tu masih dah T1, masih awal lagi, tapi risiko untuk cancer tu merebak pergi limpa is almost 10%. So of course the cancer early, but the treatment is always, we have to decide based on the patient's age, morbidity and things like that. So it's very extremely important. And for endoscopically, is another thing that we can actually do is actually stenting. This is mainly for palliative patients who are stage 4 disease. When there is a tumor and you already know these patients ada cancer tempat lain, then kita akan pasang to stent so that they don't get blocked, so they can continue with their chemotherapy or so on, which is the main treatment. Or sometimes we do stenting sebagai bridge to surgery, iaitu bila pesakit tu datang dengan usus sumbat, so if you go in and do a big surgery masa kecemasan tu, you end up ada stoma for life, or it's going to be a long term stoma. So untuk prevent adanya stoma ataupun usus terkeluar tu, kita akan pasang stent sementara waktu. Bila usus bengkak semua sudah kurang, it's already gone down to normal, then within 2 weeks time we go in do a proper surgery, kita buang cancer and sambung balik tu usus. So these are the role of stenting as well. And surgery is always the gold standard. Bila kita buat pembedahan, kita buang cancer is the gold standard. Okay, for stage 1, 2 or 3, bila kita buat pembedahan, kita masuk dengan intensi untuk sembuhkan 100% sebanyak yang boleh. But for stage 4, bila kita buat pembedahan tu hanya untuk palliation. Palliation maksudnya supaya dia masih boleh makan, buang air besar, menjalankan kehidupan yang normal sebanyak yang boleh. The intention is not to cure the patient. Okay, and how we do surgery, we can either do a open surgery, people used to do last time, potong besar-besar, right? Or laparoscopic, kita panggil minimally invasive, or keyhole surgery. Or another thing is called robotic surgeries. Okay, and open surgery is perut kita is a long incision besar, so usually done emergency settings or when the tumors or cancers are very advanced. So you definitely have to do this. Okay, But nowadays most of the time when we do laparoscopic surgery. When we do laparoscopic surgery, pembedahan tu dibuat hanya dengan lubang-lubang yang kecil begini. So probably a small wound kat sini untuk keluarkan cancer. By doing this, the pain is lesser, the wound is smaller, patient akan tinggal di hospital much more shorter time. Okay, but this not everybody can do this surgery, and you need advanced training, especially in colorectal laparoscopic surgery, and usually focuses for colorectal surgeons to do this kind of procedures. Yeah, and this is an example. Yeah, you see the wounds here. When we do laparoscopic surgery, it's just a small wound here. Yeah, so you don't have to open the surgery, and from the camera here you can actually see what we are doing and go on with that. And this is something that we call as a robotic surgery. It's mainly beneficial for rectal cancers. It's expensive. The availability is an issue. I think in Sabah we don't have any robot. I think at the KL we do have some robots in KL. When you talk about Gleneagles, I think Ampang Gleneagles has got a robot there as well. And of course you need a special training for you to do this kind of surgeries. Yeah, and this is an example. Okay, patient is here, the surgeon or doctor is sitting quite far away, maybe in the same room or the next room, and you are doing the surgery while sitting down here, and the robot here will actually do the surgery for you at that time. Yeah, and what are the types of surgery? How macam mana is, I think it all depends on the salur darah yang supply kepada cancer. Yeah, and if you look at this image, I'm just going to go through very briefly, just give you an idea. Kalau cancer tu bahagian sini, you have to take out this part of usus. If the cancer is this part, you have to take out this part of usus, and so on subsequently. This is untuk dubur and so on. So most of the time when we do cancer surgery, it's very important for the right person to do the right surgery, because it reflects the prognosis. How well the surgery is done depends on how good the results are at the end of the day, and it has to be done someone who does this same surgery again and again or multiple times to get the best results. Yeah, so once the surgery is done, subsequently it's always chemotherapy and radiotherapy. Yeah, we talk about radiotherapy. For colon cancers, usually kita tak pakai radiotherapy. It's only for chemotherapy. It's either as an adjuvant lepas pembedahan or as a part of palliation. Yeah, for rectal cancers, it's always, most of the time we always give neoadjuvant radiotherapy, unless the cancer tu masih very early stage. The reason why we do this is to prevent or to reduce the risk of cancer tu datang balik lepas pembedahan. So kita bagi radiotherapy dulu, baru kita masuk buat pembedahan. Okay, and followed by adjuvant chemotherapy and so on as well. Okay, so sometimes it's just not about doing the operation and finish. Okay, I'm done with the cancer. You're completely free. Yeah, if you look at the data, cancer can come back anytime, even after the surgery. Though our intention was actually to cure, but there's always a risk of the disease to come back, and this all depends on the stage of the disease. Yeah, the earlier the stage of the disease when you've been diagnosed, the risk of the cancer recurrence is much more lower. But if the disease is been detected at much more later stage, then the risk of recurrence doubles up or triples up as well. So for me, follow up for live cancer patients usually most of the time is lifelong. Yeah, but we do active surveillance for the past 5 years. That means every year for the past 5 years, we need to really check on you in terms of your scope, your blood test or CT scans, imaging need to be done to make sure if at all the cancer comes back, we detect it much more earlier and do the needful subsequently after that. Yeah. So after all these talks, you probably can ask me, how do I reduce my risk of colorectal cancers? Yeah. Of course, first of all, I would say if you are in the risk in terms of age, family history, get yourself screened. Achieve a maintain healthy lifestyle, exercise regularly, have a diet which is high fiber diet, avoid smoking and alcohol if possible. Yeah, okay. And if you ask me, a take home message if you have any of the alarming symptoms, please consult the colorectal surgeon as soon as possible. It's best to see a colorectal surgeon because it's easier for us to take on subsequently after that, because we know the entire disease process as well. So if you're in the high risk group, always get yourself screened as much as possible. If your family members, advise them to get screening so that things can be done much more earlier. Of course, end of the day, lead a healthy lifestyle. You can follow us at Colorectal Surgery Sabah. We've got our Facebook and Instagram. We put up a lot of information there, or you can even ask us questions if you have any issues, so we can advise you accordingly after that. So with that, I would say thank you and hope that was very useful for you all.
Did you know that on average over 50 Malaysians die of heart disease every single day? This makes it one of the leading causes of death in Malaysia. Heart attacks can happen anywhere, anytime. And when they do, immediate healthcare is critical. Take this guy for instance.
Sir, are you okay?
Let me just spin.
Hang on, I'll help you.
Kamu panggil siapa?
Emergency services.
Cuba kamu panggil ni.
Hello?
Glen Eagles has their own dedicated emergency line that you can call 24 hours a day. Wow, that was quick. Mestilah, because when a person has a heart attack, appropriate action must be taken within the first 60 minutes. This is often referred to as the golden hour.
Okay, thank you, Dr. Krishnan, for the sharing. Now, before we end, do you have any last advice for our viewers today?
Okay, as I said in my last slide, the last advice is always get yourself screened if you're more than 50 years old or if your family history. Lead a healthy lifestyle. Any signs and symptoms early, seek a doctor. Especially look for a colorectal surgeon, so at least you can be checked thoroughly before we actually say this is just normal things. Don't take it lightly. If you look at the statistics, as shown that Malaysia colorectal cancers is very high. So get yourself screened early, prevent the cancer as much as we can. Thank you very much.
Okay, thank you so much, Doctor, for the sharing. I believe all the viewers out there receive a lot of useful information through your session today. Thank you once again, Doctor. And now to all the viewers, if you can see on your screen, we are having this Pinktober fundraiser in collaboration with Kinabalu Pink Ribbon. We are selling this limited tote bag for RM25. All proceeds will go directly to Kinabalu Pink Ribbon. If you are interested, please WhatsApp us at 016-224-4773 to purchase. Get yours today and stand a chance to win Women Health Screening Package worth 318 ringgit. Should you need further information, please do not hesitate to contact our general line at 088-518-888 or WhatsApp us at 017-9798-888. We are more than happy to assist you. We have come to the end of our live today. Thank you everyone for watching and see you next time.